So hello everyone. Today we are here to discuss regarding the irritable bowel syndrome. So here we are going to discuss regarding the dietary and the medical management. Myself Dr. Shomu Banerjee. Today we are going to take this session, right? So let's start. First of all, your management of a patient with IBS comes up with a dietary management. So obviously there is a few general principles that we have to keep in mind. Number one is that the small frequent meals, that is very much important. So you ask your patient to take small meals but in a frequent interval, right? Avoid skipping the meal because that's going to worsen the symptoms of the patient in such cases. Okay, always ask your patient to eat slowly and try to chew the all the food particles well enough, right? Always ask your patient to stay hydrated, like minimum 8 glasses per day, like around 3 to 5 liter, 3 to 4 liter per day, like in a humid conditions like our Indian subcontinent, that would be very fine. Now also you ask your patient to track their symptoms with a particular food diary, like which food they had taken, and if there is any recurrence of the symptoms is there with that particular food is there or not, they need to understand. Avoid some triggers food, obviously from that food diary they are also able to understand that the some particular foods basically triggers this symptoms, so that they can avoid such triggering food particles, right? So this is again another important aspect. Then comes your dietary approach. So regarding the dietary approach, obviously we have gluten free diet and the low FOD diet. So is low FOD diet, there is a three phase plan, right? So it starts with a restriction, then comes your reintroduction, then there is a personalization. It's typically effective in around 75% of the patient. Okay, so what did they ask you is that there is some foods they are supposed to ask you to eat, and some foods are supposed to be limit, right? Like the onions, garlic, wheat, legumes, and the dairy products are supposed to be limited, or you must avoid such things. But you are supposed to eat rice, egg, and the lactose free dairy product in that case. Then obviously comes your gluten free diet, which is basically beneficial for some, especially non-celiac gluten sensitivity. Okay, so obviously the foods are supposed to be uh, eaten by you, that is your gluten free grains, or sometimes quinoa is pretty much good, but you ask your patient to limit the consumption of the wheat, rye, or barley. Okay, so this is your gluten free diet. Now your high fiber diet, obviously it always helps any kind of constipation as well as constipating IBS, or the constipation predominant irritable bowel syndrome. It basically slowly increase the fiber to avoid bloating. So always start your patient to take the fiber diet with minimal content and then gradually increase the fiber content in the food. Okay, so there is a oats, there is a chia seeds, and also there is a soluble fibers uh, to eat in that case. Bran is there, excessive insoluble fiber is supposed to be avoided in such cases. Okay, now the common foods that is supposed to be limit in case of IBS, like the high fat or the fried foods, these are pretty much bad for the IBS, that are often exacerbate the symptoms in that case. Also, like you ask your patient to avoid caffeinated drinks, there is a alcohol or some carbonated beverages. These are also supposed to be avoided in such cases. Apart from that, your spicy and the processed foods are not good. Also the artificial sweeteners like the sorbitol and the mannitol. Okay, these are the things that is pretty much poor prognostic value. Now let's try to understand the role of the probiotic and the supplements in that case. So obviously there is a certain probiotics that may help reduce bloating, irregularity. Also there is a common strains like the lactobacillus, uh, bifidobacterium, and the fiber supplements, specifically like the psyllium. These psyllium fiber supplements are basically preferred always over the brand, right? So obviously you have your probiotics that can give you some good results specifically to reduce the bloating and the irregularity, and there is your fiber supplements like the psyllium. Now let's try to understand the first line management. So obviously we have the antispasmodics which are specifically used for the cramps like the dicyclomine, peppermintoin. These are the antispasmodics. Then comes your antidiarrheal, which is the loperamide. Loperamide is specifically used for the IBS for diarrhea predominant cases. So your antidiarrheal are typically used, but here the doses are supposed to be same as for the a normal diarrheal cases. Then obviously you have the laxatives. So in case of laxatives, obviously there is the osmotics or the stimulant types. Laxatives are basically preferred. So it's a constipating predominant IBS where we can use the laxatives. You have the fiber supplements like the psyllium with a mild constipation you can easily go for. Then comes your second line, obviously your antibiotic like the short-term course for the rifaximin is basically provided to be pretty much good for the diarrhea predominant IBS. Obviously, you have the neuromodulator like the TCA, tricyclic antidepressants, and the SSRI. So in the TCAs, obviously you have the amitriptyline, which is basically good for the pain as well as for the diarrheal types, and the SNRI, which is the sertraline, may help IBS with anxiety and the depression. Then comes your peppermint oil capsules, which is basically internet coated forms, relieves the discomfort in such cases. Also, there is a probiotics, which is a patient specific effectiveness are supposed to be there. Okay. Now, regarding the behavioral and the lifestyle therapies. So, obviously, in the behavioral and the lifestyle therapies provided to be very much important while managing a cases of the IBS. So, your cognitive behavioral therapy, like the often doctors basically nowadays refer the patient for CBT or the a cognitive behavioral therapy in such cases. Also, there is a gut directed hypnotherapy, which is eventually very much helpful in some cases. You ask your patient for the regular exercise that will eventually increase the gut motility as well as for it is good for the mental health as well. So always the stress management through yoga, meditation, and the counseling is provided to be very much important. But the sleep hygiene, which is which has a significant impact on the symptoms. So always ask your patient to maintain or have a good sleep, good adequate sleep that is supposed to be needed. Regarding the special consideration like the IBS symptoms, they and the triggers, they can vary widely patient to patient. So that's why your personalized approach for each patient is supposed to be recommended. Like you cannot prescribe every patient with a same a format of drugs or the same format of advices. So you have to take a detailed thorough history in that case, so you have to personalize the care. Also there is a tailored diet based on the intolerance profile that has been also there, like the medical treatment based on the symptoms subtypes like the eye constipating diarrheal types of IBS are also there. Now, your dietitian or sometimes physician's collaboration is very much important, but obviously, please do try to educate your patient and try to raise the awareness uh, regarding the disease that will eventually reduce the fear and a fear of the patient regarding the disease, and eventually that in the long term will help to improve the proper control over the disease. Okay. Some complementary or the alternative therapies are also there, like there is evidence that is accumulating that a variety of therapies can modulate stress hormone and the other physiological functions. So there is a different therapies like the physical therapies where the massage, acupuncture, reflexologies, or the shiatsus are may release the tension, and in that a mechanism they will eventually help the patient with such cases. Then comes your meditation or the hypnotherapy, which basically produce the focus relaxation that may facilitate cognitive behavioral changes. And then comes your biofeedback, which may patient gains the control over their symptoms. Okay, so thank you for this session. If there is any queries, please do let me know. I'm happy to answer your queries.